My name is Sherry Avila, and I am going to be your hostess today for Avila, Chicago, Making a Difference. And with me I have as my guest Dr. Lawler. And before we get started, Dr. Lawler was involved in the Hurricane Katrina relief effort. And I would like to just mention that actually my husband and I were in New Orleans about a year and a half ago. We had gone there for a conference. And so when this all happened, we were in shock because it felt like we had just been there, even though it had actually been about a year at that point in time. And so we were just in shock to see and hear all about this. And we had talked to people who had been through other hurricanes down there, and they were telling us about their experiences. I remember one guide that we had that told us that the next time he'd leave because he had stayed and he was on one of those houses that are on stilts, and he said that it was a nightmare. But then we talked to another person who said this time she's going to stay. So it's interesting how different experiences cause people to do different things in their lives the next time around. Now, Dr. Lawler, how did you become involved in the Katrina relief effort?
Well, like you say, I mean, I had watched, like you had, the television coverage of this incredible disaster and wanted to do whatever I could to help. I am actually from Louisiana, grew up there. I went to medical school there. I came to Chicago for my internship and residency and have lived here ever since. But obviously my roots go back deep to the country that I grew up in. So I immediately after the hurricane went on a variety of websites trying to find a place to volunteer to go to help with the relief efforts. And the feedback that I got was that the response from medical personnel was overwhelming, and that there were hundreds of thousands of medical personnel that had volunteered and they didn't need my services. So I figured that the need had been met, that things were settling down, and really hadn't given it much more thought. On Halloween morning, I opened my email and there was a message from Health and Human Services saying that I had volunteered back the beginning of September and was I still willing to go to Louisiana. And I said yes, and the next day my cell phone rang and it was Katrina Travel asking me where the closest airport was to ticket me down to Louisiana. So away I went.
Now, how did you prepare for a trip like that?
Well, Sherry, I had less than 24 hours to prepare, so there really wasn't a lot that I was able to do.
I don't know how anybody could prepare for a trip in less than 24 hours. Not me.
Well, it felt like I was sending somebody off to camp, only it was me. But we were sent a brief list that said what we should bring and included things like a sleeping bag and towels and soap and insect repellent and sunscreen. They also told us we needed to bring a black or green flashlight. And since these were instructions from the government, we all complied with these instructions, but we never figured out why the flashlight needed to be black or green. I went out shopping and I got the things that I didn't have that were on the list, and I started to worry that I didn't know what the conditions were going to be like. There was absolutely no information that was provided to me of what I was getting into. And I was concerned that I was going to be living in a tent, and was there going to be water? Was there going to be toxic waste? Would I need some kind of material to protect me from contaminants? And at the same time, it seemed like it was so far away from the actual event that maybe I was just going to be in an office providing care to patients providing relief for doctors that had been there for a long time. So I tried to pack for every eventuality I could think of, and they told us to pack in a small suitcase because we were going to be living in tents. So
now, how small are we talking here?
Well, I had a duffel bag And I don't know what they had in mind, but I tried to put it all in a small duffel bag.
Like an army duffel bag,
yeah,
or a health club duffel bag?
more like a big health club duffel bag. So I didn't have much with me, and you know, I just hoped that everything would work out.
Now, where did you end up staying? Did you stay in a tent?
We actually wound up not staying in the tent. I took a direct flight from Chicago to Baton Rouge, and when I got to Baton Rouge, I found that the tent city was actually not taking any more new personnel because the local areas was experiencing, of all things, record-breaking cold, and people in the tents were getting sick from the cold and the damp conditions. So they housed us at a local school that had dormitory facilities, so we were on cots in the gym, and so not in tents, but we still used our sleeping bags, and we had electricity. We didn't need the flashlight.
Now, were you on the first floor of the school, or was this a school that had more than one story?
No.
Okay.
No, it was a one-story school, and
okay. Okay. And did you know any of the other members of your medical relief team?
I knew no one down there. At this school, there were about 200 people, and there was a small group of public health service officers that were taking the lead in the administrative functions of the team, and the rest were all volunteers from all areas of the country. There were doctors, nurses, social workers, funeral directors, and they came from everywhere.
Well, so they weren't all medical people.
Mostly medical social workers. And,
oh, I see. They were associated in some way.
In some way.
Okay.
Right, sure.
I understand.
Yeah.
Okay.
Yeah. So we all came together, and the day after we got there, we were assigned to a smaller team, and my team was about 20 people. It varied a little bit, but about 20 people. We had about 6 doctors, 10 to 12 nurses. We had a physical therapist at one point. We had a pharmacist, social worker, and even though I had never met these people before, we became very close in a very short time.
I'm sure. I think that there's no doubt when you are involved in a situation like that, you depend upon one another for starters.
Right.
And you all have that common experience too. As I know that when we were with the Girl Scouts, and my daughter was with the Girl Scouts, and when it rained and poured, and these girls were all in the flooded waters in the tent,
yeah.
We all had that experience to share, you know. But how difficult it must be not only to have the rain pouring and to have your homes ruined and and the wind blowing, and then to have unseasonable coolness on top of it.
Yeah.
That must have really been awful, to have the unseasonable coolness. It seems as though we're always somewhere where it gets unseasonably cool. Now, exactly what did you do in your capacity as a doctor or as a medical relief person?
Well, it turned out that our little group was a mobile medical unit. So the day after being assigned to this mobile medical unit, we got up at 6 o'clock, got together, had breakfast together, and got on a shuttle bus that was going to take us to New Orleans. And this is about a 3-hour trip, but there was no place to stay in New Orleans. They had hoped that we were going to be able to stay in a hospital in New Orleans, but the air quality was so bad because of the mold and the dampness, they didn't think it was safe for us to stay. So every day we traveled the 3 hours down.
3 hours?
And 3 hours back.
Oh my God.
Because there was no place to stay in New Orleans. So we got on the bus and we traveled through the bayous into the city. The bus pulled up at this dusty parking lot and said, "Here you are." And we got off the bus and we set up our tables and chairs.
Oh, and you had to set everything up?
And
every day?
Every day.
Oh my gosh.
And we had talking about the Girl Scouts, we had a shade canopy that would keep some of the sun off us, because the record-breaking cold lasted for one day. then it got back to the 80s and 90s, and we were out in the sun all day long in this parking lot with 14 porta potties, and there was one shade canopy when we started, and we turned out to be sort of like the MASH unit, that every time we went back we tried to commandeer a little more shade, and we wound up with 6 shade canopies by the time that we left. We saw about 200 people, and we saw a whole gamut. We saw just about everything that you could imagine to see in a situation like this. So in our parking lot clinic, people came up that needed medical care. A lot of people that didn't have any way to get routine medical care. The private physicians that from the New Orleans area had no places to put their office. Even today, approximately half of New Orleans has no electricity. So private physicians are coming back, trickling back in small numbers. Charity Hospital is closed. Tulane Hospital is closed. The VA hospital is closed. So people came to us to refill their prescriptions.
Oh, so you, oh yes, you said you had a pharmacist.
We had a pharmacist. We had a small pharmacy of medications, some that were donated and some that had been purchased by the government. And we had arrangements with one of the local pharmacies that was operating out of a trailer. And we were able to write prescriptions for patients. We had a number of very sick people. You know, we had people come with chest pain, people that we thought had heart attacks. And the 911 service, as far as I know, is still not operating in Louisiana. It was certainly not operating when we were down there.
Oh.
So the ambulance service was provided by private ambulance. And if you had the $1,000 up front, you could be transported by ambulance.
Oh my. And to you? Was transported to you, or to where? Where would they be transported?
They would come to us, and you know, we had, you know, one person whose blood pressure was dangerously low. The ambulance would come and would take them if they had the money to go.
From you.
From
they would take
us,
you from you.
And actually, to is a good question, because the ambulance service said that all the emergency rooms, from time to time, all the emergency rooms in New Orleans Parish were closed, that they would have to go to an outlying parish to seek care, and were the people willing to spend the money for the ambulance to get there. And the waits in the emergency rooms were 24 to 48 hours to get in the door to the emergency room. There were lines out the emergency room for emergency room care. So we felt like the care that we provided averted a crisis for all these people. Because even if you were just coming to get your medications refilled, if you couldn't get your medications, then you might wind up in the emergency room. So we provided.
So it's a catch-22.
Yeah. And we saw about 200 people a day. It was a busy practice.
200 people a day? And how many other medical doctors were there?
There were about 5 other doctors.
5 medical doctors.
And we all, one of the most touching things about the whole experience was not only had all these people volunteered their time to come to serve in New Orleans, but the people that, the other physicians, we had 2 pediatricians, and pediatricians, I'm an internist and geriatrician, so I treat adult diseases. There are no children in New Orleans because there are no schools, there's no electricity, there's no 911. These pediatricians were seeing adult patients and trying to go back to their training and reading books to try to figure out how to treat these people.
Oh my gosh.
We had an OBGYN who was our only surgical type physician there. So anything that required some surgical expertise was done by the OBGYN doctor. So everybody just gave as much as they could give. And it was a remarkable experience.
So you were saying that there were very few, maybe there were a few children that cropped up?
There were a few children. There were a few children.
On the whole, mostly adults.
Mostly adults. The children that we saw mainly were on Sundays. People would come back for church services, and they would bring their families. And Sherry, they would come from Houston, which is over 200 miles away. They would come from Tennessee. I mean, it was just absolutely remarkable, the spirit of these people to want to come together as family and community to come back to their church. And that was when we mainly saw the kids.
They came back on Sundays to go to church.
On Sundays to go to church.
That's fascinating. Now what about security?
Security, actually, we had there were 2 security people there, and they were employed by the government, and they were volunteers, and they were both police from other areas of the country. So, you know, we felt very secure, and in fact, at the time that we were there, crime is at the lowest ebb ever because nobody has anything to steal. Mm-hmm. And you know, everyone is completely involved in trying to rebuild. So we felt very secure, but there was security around us at all times.
I had wondered if perhaps you might have had some problems with the drugs, but that wasn't nothing.
We had no kind of drug. You know, we had blood pressure drugs, diabetes drugs, very boring things that nobody would want to steal.
Now, what did you do in your spare time between helping all these people, these 200 people a day?
These 200 people a day. Well, Sherry, you know, we got up at 6, got together for breakfast, had our team briefing, got on the bus at 7, set up camp, saw patients until 3 o'clock so that we could then pack up the camp and get back by 7 o'clock to shower the dust off and have dinner. So we didn't have much free time.
Okay.
But one Sunday we did take a couple hours out, and we wanted to see what the area was like. The camp that we were at, the unit that we were in was right at the corner of the French Quarter, and the French Quarter was actually not flooded, so that area did not have the kind of severe devastation that some of the other areas had. So we wanted to do a little bit of looking around.
I had heard that the French Quarter wasn't as flooded.
Yeah.
Which was good because actually that's one of the main areas of the tourist attractions.
Right.
I think.
Right. It's the only way that they're going to be able to rebuild is to bring tourists back, and so thank goodness that the French Quarter is still undamaged. But we went into some of the areas. Actually, the flooded areas look like what I imagine a nuclear bomb, you know, must do to an area. Everything is flattened. It's just unbelievable. But there are areas where there was not flooding, and the houses are still standing, but all the windows are blown out, and you can go for miles and miles and see these beautiful 2-story brick homes, not just the poor homes that, you know, that we see a lot on the media about, but beautiful, you know, suburbs where you can street after street after street, and there's not a car moving, there's not a dog, there's not a bird, there's not an insect. It's completely silent and still because there's nothing there. And to me, that was the most profound, I guess, experience of the devastation that you can't see from looking at pictures or videos, is the silence, the stillness of nobody being there. It would be like driving from Chicago through suburb after suburb where there are nice houses and there are not so nice houses, and just everything you can imagine, but nothing's there. It's all covered with dust. All the plant life is dead because of the wind and the water and the lack of people to tend it. So we talked about how it's like a science fiction movie where you wake up and you're the only person alive in the world. And that's the kind of devastation that you see down there.
Did you write keep a journal, or?
I did keep a journal, and I you know, and some of the other people in the group kept journals, and we all have exchanged our journals. We still keep in touch. We email, you know, what I found is that it's very easy to kind of become emotionally detached from this experience. So keeping a journal is really helpful to remind myself that, you know, the need is still there for people whose lives have been totally disrupted.
Now, how long were you down there?
I was down there for 2 weeks.
2 weeks. And then when you left, how did you feel it was when you, after 2 weeks? Had it changed much, or was it pretty much?
There were more people coming back, Sherry. I mean,
Okay.
You know.
So it was actually becoming more complicated.
It was becoming, right, it was becoming more complicated because more people were returning. There's still not electricity, there's not running water, there's not services that are necessary for these people. And there was no medical care. From, you know, the standpoint of what we were looking at, the numbers that we were seeing were increasing, and yet the ability to provide these services to some degree was coming to an end because of, you know, federal mandates and funding mandates. So
are you saying that when you left, another medical team did not come in and take your place, or?
There were diminished numbers of people coming in, and you know, there has been this complicated relationship between the state and federal government to decide when is it time for the state to step in and take over, and what can the federal government do, and what should the federal government do. And I guess we felt that the primary need was for people to be taken care of. So we were hoping that more people would come, and one of the people in our group that stayed a little longer sent us information that you know, a couple of clinics had opened up, and so, you know, we were hoping that there would be more people to serve the needs of this community.
Now, how did you feel your experience was different compared to your other medical team partners or members, since you are from Louisiana?
You know, Sherry, it's hard to quantify, because I think that I was perhaps more affected because I felt like these were my people. I knew them. I understood them. It's sort of interesting, and I don't know if you're from Chicago, but when you leave an area, you sort of leave that area behind, and then when you come back, it just sort of comes back with you full force. And the accent, my southern accent, came back real fast, and I felt like, you know, I had sort of more connection, and you know, and when I told people that I was from Lake Charles, which is a town in Louisiana, you know, and they would say, "Oh, so you know about this and about that." So there was more connection, but I think on the whole, the need was so deep and so apparent that everyone connected at a very deep level, and the spirit of these people was so generous. Here were people who had basically nothing at all, and one of the women that I saw actually twice when I was down there brought to me a quilt to show me that she'd gotten from a church in Rockford. She was so proud of.
Oh, because it was from Illinois.
Oh, it was from Illinois. One of the people that we saw brought us Mardi Gras beads to give to us, and you know,
to keep you in the spirit.
To keep us in the spirit, and just to think that these people have, you know, so little and still wanted to give, so I think that there was a profound effect for all of us.
So what is the lasting effect, or did this trip have a lasting effect? I mean, or have you feel like you've already shared that with me?
Well, I think that you know, philosophically, it's really set me to thinking. I got back to Chicago around Thanksgiving time, so it was time for me to be buying Christmas presents, and I had a very hard time buying Christmas presents because I was thinking, here I'm looking to try to figure out something to give people who already have more than they need, and there are all these people who have nothing at all. And that feeling has sort of stayed with me, that I need to be more mindful of what I have and be grateful for that, and that I need to give more back to these people who have nothing at all.
Now, how can the listening audience out there help the people of Katrina? What can you help us with? Can you tell us anything on that?
Well, you know, I think, Sherry, that the thing that I would say is everyone needs to be mindful that this need for help is going to last for a very, very, very long time. The telephone repair people told us that there were large areas of New Orleans who would not have telephone service for at least a year. And I think that's just symptomatic of the long-term needs.
A year?
Of the area.
They wouldn't have a telephone for a year?
For a year.
Oh my goodness.
Because they have to go out and, you know, dig everything up and redo everything. So, you know, when there are appeals for relief, give.
This is what I want you to do for me.